policy issue is that many individuals, including patients today, are overusing and misusing the drug called opioids. Opioids are a prescribed medicine that is meant to relieve and reduce pain. The misuse and overuse of this drug has increased the amount of people who die each year between different age groups. Some of it is due to the overdoses on the drug. Although individuals claim that opioids are the most effective medication when it comes to relieving back pain, there really isn't any evidence that shows that the drug gives a better benefit compared to other medicine in the market. Overall, there needs to be a proper distribution of a medication because it is causing not only death, but also addiction. Research shows that opioids doesn't always improve pain relief, but it rather can sometimes increase adverse effects.
As we can see, not only are the victims in great danger and affected by the opioid epidemic, but so are family members, friends, peers, and the community in general. It doesn't affect a specific group of people. For example, according to the NIH, the National Institute on Drug Abuse, children, women, professionals, middle to upper class families could all be victims, and it also imposes a very heavy financial cost on federal, state, and local government, so much that it has become a nationwide crisis. This crisis can also become a burden as to the victims and the bystanders because it becomes such a big cost for medical care, counseling, rehab centers, social services, just to name a few, and it impacts how society runs.
The U.S. citizens either witness the effects or are involved because they deal with the pain and addiction that comes with being addicted to the prescribed medication that they are given or by themselves. The families of the addicts are also being affected by seeing the effects the drugs are having on their loved ones that can damage their relationships. Hospitals, doctors, and healthcare providers are prescribing opioids to treat pain and also deal with addicts and related deaths later on. The U.S. government is involved because they are dealing with addiction, increased death rates, and overdoses, especially in rural areas. U.S. citizens, doctors, U.S. Department of Health and Human Services, HHS, National Institutes of Health, NIH, are all looking to prevent death and addiction but still limit the pain of their patients and loved ones. From 1999 to 2017, about 70,200 people died from an opioid overdose and 700,000 died from a drug overdose. That means that in 2017, 130 Americans were dying from drug overdose every day. The addicts range from a variety of races, genders, and ages, but the common source for their death is mainly from that of opioids. In this graph from the CDC, the deaths due to overdose are divided up by race and drug type. The blue bar represents the number of people who overdosed on opioids, and as you can tell, it is the highest bar for all the races, meaning that no matter the race, opioids are still the leading cause for an overdose.
Across the charts, there is an overwhelming agreement that something must be done about the opioid epidemic facing our nation. There have been multiple efforts to combat the issue. Community-based organizations, healthcare institutions, state and local agencies have begun to equip and train non-medical bystanders to recognize and reverse overdoses using first aid techniques and emergency supplies of naloxone. Unfortunately, these programs remain limited in many communities with high rates of overdose because few prescribers are willing to facilitate overdose prevention education. Additionally, funding for program evaluation, research, and activities remains sparse. The FDA is also committed to taking forceful action to address the crisis, requesting an oxymorphone formulation be taken off the market, and they are also taking steps to create a better framework for prescribing opioids. Despite the harmful effect opioids have had on the nation, they are still a huge asset in pain management, and many feel should still continue to be used and prescribed in a better, more educated manner.
The solutions that we have is having a system where physicians prescribing the medication are able to review the patient's profile to avoid the misuse of prescriptions. For any acute pain, physicians should reduce the dosage of medication being prescribed. After physicians have prescribed a patient with medication, they should be able to report this in PDMP to track prescribed substances. This graph shows that programs help pharmacies check on the status of any prescribed medications from physicians. This chart demonstrates that only half of the physicians check the state of the PDMP. Only 14% of physicians always check the program. The government role is in solving the issue is adding $500 million to the National Institute of Drug Abuse. This money is invested to focus on improving opioid addiction, treatments, and enhancing pain management to prevent addiction and overdose.
An effective first step to reduce opioid use is through education. Doctors should be required to take additional certification programs to reduce medication malpractice. Adding on, a set of guidelines for use by all physicians should be implemented to receive updated information on prescribed medication and a possibility of alternative coping mechanisms when it comes to treating acute pain.
Funding for this solution has already been provided by the Centers for Disease Control and Prevention, also known as the CDC. The CDC has awarded the states $155 million to fund research for understanding the opioid overdose epidemic better and to find better ways to prevent people from overdosing. $27 million have also been distributed to 9 other non-government organizations to enhance the training in local public health. The CDC also provides resources for providers to manage patients that are prescribed opioids.
A barrier to this possible solution is that providers may still continue to incorrectly prescribe different opioids and not be aware of the correct dosage and mistakenly prescribe a patient with a too high of a dose that can lead to addiction and potential overdose. It is also likely that providers will take many years to fully adapt to the new guidelines, since not all doctors have been prescribing them in the doses that they should be and should have been for so long. But substantial training in pain management and addiction medicine should be required because opioids should not be prescribed for pain-related situations, since the patient could become dependent on them and can have detrimental outcomes on their body. Lastly, we will be hearing from Patty Galindo, who is a program assistant for the Intensive Outpatient Program for Substance Abuse at Thelma McMillan Center at Torrance Memorial Hospital. She took the time to share some of her insight on what it is like to work closely with chemically dependent patients.
My experience at Thelma has been very rewarding in the sense that I'm able to change people's lives. To see a patient not only graduate but remain sober the entire program is rewarding for me. And also to see them regain their life and the most important, regain their family. The most hardest part about working at Thelma McMillan for me is when a patient comes in and is assessed by a counselor and the treatment is recommended and they walk away. And I wish I could, talk to them again and help them and explain to them how much we can help them. Also, another hard part is when we hear from other patients that they have overdosed on, their drug of choice and they've been our patient. I always say to myself, why didn't they come to get help here with us? I think that people will continue to use drugs even though they know it's unsafe for them because it's very easy to get nowadays. And also it relieves prompt pain relief for everyone. I think that's great because nowadays you can go into a doctor's office and you're there for pain and they right away give you a prescription for painkillers without knowing whether you have a chemical dependency on any type of other drugs, and I think it's a great idea.